Well, good morning, everybody. Any SOS concert goers here tonight? There we go. So if you see baggy eyes, some of us were at SOS last night. Amazing concert, brought back memories. Last time I saw them was Kona, Hawaii, probably 1971, 1972. So like this conference today, there was some aging going on, right? I think Tony and there was one other fella at the seven that were the original guys. And they showed a clip. I didn't know they were an Ed Sullivan show in the 1964. So do the math. They're pushing their 70s, 80s now. But they're up there, they're still performing. So hopefully that shows too, there's a bright future. Some of us may already be that way. I'm gonna be 62, so Social Security, Medicare, they're really part of vocabulary. But I'm so happy that you can come out this morning. It's early Saturday, but at the same time, aging is inevitable. Aging with confidence, that's up to us, right? Ways that you can be aging with confidence. One is physically, take care of yourselves, do your things, follow your doctor's orders. Eat good breakfast like this, but not in excess, right? But also aging in confidence means about having a plan, being prepared. I mean, that's my Boy Scout learning. You be prepared, you have a plan, but also be knowledgeable, understand things. You may not know everything, you don't need to know everything, but know some of the key things. So my goal this morning, I get half an hour to help explain a little bit about the healthcare system. So some of you may be very familiar with it because you're either in it, but it's like a big elephant. Sometimes you just see your one part. But if you stand back, wow, that's a whole big complicated system out there. So I hope one of the end goals today is you'll understand a little bit more about today's healthcare system, how it affects you, and then also if you happen to be in that situation, we call it the sandwich generation, everyone will be there someday. Our parents were there, right, when they were taking care of their parents and taking care of us. Now it's shifting to us. And so several of you in this room, I know you're sandwichers like me. I don't know if you're spam sandwich, tuna sandwich, or what you like. At the end of the day, we got to figure out, we got to have a plan, you got to be prepared. And when you have a little bit more knowledge, you could be more confident. So I'm just curious in this audience, even though this is about healthcare on my part, how many of you guys got your cars tuned up within the last 12 months? Please raise your hand. Right? Okay. How many of the same guys, how many have you got a physical in the last 12 months? Okay, so there's a pretty good, but I saw fewer hands than they got their car tuned up, right? So, hey, cars, we could go get parts and replace them, but these bodies, we get one of them, right? So as we get age, especially, we pay the price tomorrow for what we're doing today. So cars, if you don't change your oil, what happens to the engine? It burns out. At the same time that you replace the engine, for us, if we have too many eggs or bad cholesterol things, what happens, right? I guess you could replace a heart, but that's expensive and not everybody's heart's going to be replaceable. So that being said, let's get into an overview of healthcare. And that's going to include some parts of what you need to consider. I hope it'll help you understand how today's model is set up. It's always changing. Technology, for example, just as Tom said, it changed the way you plan your vacation. It's also going to change the way you work with healthcare or are affected by healthcare. Because technologies today are moving care from the hospital down to the home level now, which is kind of a good thing. I'd rather be home than stuck in a hospital, bad food and a lot of noise going on. But again, you're gonna have more choices because technology is gonna enable us. So with that, let's see if I can use the projector thing correctly. All right, there we go. So healthcare will affect us all one way or another, physically or financially. I don't know if you're aware, but healthcare is the #1 cause of bankruptcy today in the United States. Even if you have insurance, doesn't mean, again, everything will be covered. Medicare folks in the room, I don't know if you're fee-for-service, 20% of your costs are on you. 80% is what the government will pick up. So that 20% on a $100,000 procedure, that's a lot of money. Jason's going to give you all the solutions on how to handle that on his talk. But so healthcare is very expensive. 17, almost 18% of our gross national product today. So literally, whether you're paying your taxes or your employment, you're being affected by healthcare. Almost 20 cents on every dollar is going to healthcare. For us that work in healthcare, we like that. But on the other hand, if it keeps growing, the healthcare pool is going to take away from education, our defense, and other things. So there's ongoing efforts. How does the U.S. manage its healthcare? Countries like Canada, Great Britain, Japan, they have national healthcare systems, right? So everybody has healthcare in those countries. We're going through changes in our country where We had what was called Affordable Care Act, or Obamacare. That's been changing as we speak. So again, I think as we're getting through what healthcare in the U.S. is going to look like, today I hope you'll understand at least some of the ingredients or elements of the U.S. healthcare system. The other impact here, I talked about the sandwich generation. So aside from pharmaceutical costs, which is one of the fastest growing costs of the U.S. healthcare costs, the baby boomers are getting older. We're going to be consuming even more and more parts of healthcare. There's a rule called the 770 rule. I think it's in the last 7 months of your life, typically 70% of your healthcare costs are going to be consumed. So that just shows you the curve. It might be nice now, but all of a sudden that fall or that accident, it's going to just skyrocket your cost or your family's costs. So hopefully today you'll get a little bit more information or insight on things that you might be able to do to help plan for that, as well as models of care that might help you get through those episodes of critical care. All right, so in the healthcare system, there's two main payers called payers or providers, all right? Payers are the ones that help pay the bill. You're a payer, but typically we lean on insurance, right? So insurance, there's public insurance, public sector, which is a government, Medicare, Medicaid. For children under age 18, it's called CHIPS, the health bill for children that helps make sure that kids all have access. Medicare is for those that are 65 years and older. And we'll talk a little bit more about qualifying for Medicare, because if you're not 65 yet, obviously we hope that we'll at least get there and then use a lot of Medicare someday, because that's what you've been paying your taxes for all the years. Medi-Cal in California is also known as Medicaid outside of California. Public sector side, versus private sector, like Kaiser Permanente, Blue Cross, Blue Shield, those are like commercial or private insurers. And by the way, guys, everything is in your handouts here, so you don't have to memorize anything. But the private sector side, there's different formats. You've heard of like PPOs or fee for service. That's an indemnity-based type of insurance. You have more flexibility maybe in terms of having your choice, whereas in managed care or HMOs, you need to go through what are called gatekeepers typically. But there's different strengths and weaknesses of both public and private side. But you understand two different sources, right? You have the governmental programs, and then you have the private programs. Anyone understand back, let's see, pre-1970s, there was no such thing as an HMO. It was actually during the Nixon administration, they passed the HMO Act. And that's where programs like Kaiser Permanente, or some of the older folks might remember FHP here in Fountain Valley. Those are the programs that offered a different set of benefits, and it pays providers on more of a risk-sharing model. So it kind of changed the game, where instead of doctors just submitting bills and bills to insurers or to the government, it said the payers now said, we're going to give you a pool of money, and that's up to you to take care of the patients. So it changed the model of care. So good HMOs, like Kaiser Permanente, for example, they focus on wellness. Because the more that they can keep you healthy and do prevention, immunizations, pap smears, prostate checks, that keeps them from having to spend more money when you have to go to the hospital or get surgeries and things that cost a lot. So it's a different model of care. So I just want you to understand, when you're making decisions about health care, if you understand the fundamental differences, that'll help you make a more informed decision of what might be good for you. Pharmaceutical coverage is very different. And private models, for example, you're going to learn they have what are called networks, right? Networks are hospitals that are part of the network, doctor groups that are part of the network. Those all help determine, like again, if you're wanting a covered benefit, if you use a network provider, you have better benefits. If you go outside of that network, you get less benefits because they've negotiated contracts with network providers. So from a contract standpoint, it helps the insurer keep their costs down because they're getting discounts. But if you go out of network, they don't get those discounts, it costs them more, and essentially they're going to say, well, then you got to pay a little bit more of that. Let's see. Other forms of insurance here. Some of you may have long-term care insurance. So traditionally, we have the medical insurance that covers acute hospital stay, some home care. But like long-term care insurance, it's a different version that's more for chronic types of things. It'll pick up areas that traditional insurance does not cover. So like skilled nursing homes, assisted living homes. Your traditional insurance will only cover very little of that at most, whereas long-term care will pick up those gaps. So for any of you in the room, or if any of your parents have long-term care insurance, it's really important to help understand how that either supports or covers the gaps of what your private insurance does not cover, or things like Medicare, Medi-Cal will not cover. Other insurance programs out there, dental, vision, and I know we even pay for pet insurance for our pets now. They have even those versions out there, but insurance is insurance. You hope you never need to use that, but if you have a good policy when you need it, whether it be your auto, your home, even medical, you know what you got, and you know what it's going to cover and what it's not going to cover. That's going to give you more confidence, because when you make that decision, most times it's in the fall, right, that you enroll in insurances. You'll help yourself and your family by being informed about which is a better benefit for us. Maybe we need to focus on the pharmaceutical coverage because we're seeing, mom and dad's medications, their costs are going up. Which plan will give us better medication coverage? Let's see. How do I flip this? Okay. So we talked a little bit about the payer side of healthcare. There's a provider side. So providers could be the doctors, the nurses, the pharmacists, but also there's the bricks and mortar elements of healthcare. So those would be like hospitals, for example. We call it the medical care continuum. The highest level, the most complex care is going to go to the hospital. And then from there, as you go down the continuum of care, you have things like skilled nursing, subacute, assisted living. In hospitals, the main entry points, you have two ways. You go in electively because the doctor needs to do a surgery, and then you stay there for recovery. Unfortunately, there's the unplanned one, and you guys all know about those probably. Dr. Howard Nakashoya, he works in what I'm called an emergency room, right? Those are unplanned events. And then parts of your benefits, which we'll talk a little about later, good health plan benefits, they're more comprehensive. They'll cover the acute side all the way down the care continuum. And there's certain rules that if you're aware of, all health insurers have to honor what's called EMTALA. That's a law we're going to talk about in a little bit. It enables you to go to any emergency room. Your insurance company can't say, oh, they're out of network. That doesn't apply to emergency care. So specialty hospitals, the rehabs, orthopedics. We have Chalk in Orange County, which is an excellent children's hospital. There's behavioral for mental, psych. Because in general, hospitals take care of medical situations. Some may have a psych unit. Very few. I think in Orange County, there's only a couple of hospitals that have both psych and medical. You got to be discharged and go to a specialty hospital for other types of services. The long-term care or LTACs, that's a step down. And by the way, as you go down the continuum, it's less expensive. So naturally, from a business standpoint, where do you think insurers want you to go? Right? They don't want you to go into any of them because that costs them a claim. But the reality is, you're going to enter the point. You don't always have to go to the hospital first. You may have had an incident. Then you need to go get some rehab. You can go over to an outpatient rehab, PT, OT, or something. But the care continuum in your neighborhood is going to help define your access. So very important. If you're going to retire, hey, it looks great. I want to move up to Mammoth Lakes and retire because I like fishing. Well, how's healthcare up there? Man, I got to drive, 40-some miles to get down to Bishop for a big hospital. You need to factor those types of things in, right, when you choose a place to retire. Fortunately, here in Orange County, LA, Southern California, we've got the whole care continuum there. We have lots of choices, and many of those places are network providers for your hospitals or for your insurance companies. Okay? Let's see. Have you, the very bottom one, outpatient care, it's happening more and more, like home care, palliative care, hospice care. I think you'll see technology is enabling more things to happen outside the hospital. And it helps because payers are starting to pay for those. If payers didn't pay for it, you got to pay out of pocket, you're going to tend less to use it. Or the other side is technology companies, they're not going to invent things if they can't get payment for it. So when the FDA approves things, insurers pay for it, you see technology companies growing, businesses in those areas because now they could get paid. It all makes sense. So one of the new areas that I was excited about in the late 1990s, because we had video technology, we're having more internet, is called telemedicine. Programs like that are changing the face of medicine. When I worked in Guam a couple years international, we're 6,000 miles away. We can't get our patients access to like neurosurgeon specialists, but by way of telemedicine, we could bring care out to remote areas like Guam, or here in the States, like in the high desert, they can now get access to doctors and providers instantaneously. In fact, through the military, we've adopted things like robotic surgeries, because you're not going to put a high-end neurosurgeon right on the front lines. So we have neurosurgeons doing surgeries from thousands of miles away on our soldiers that are getting, picking up wounds and things that they can now have simultaneous real-time doctors for specialty care. So my point is, technology is changing the game a bit for the better. Accessibility, affordability, and then the accessibility in trauma center businesses and hospitals, it makes a big difference. It's called the golden hour. If you aren't seen within that first hour, your probability of surviving a trauma go down dramatically. And I'll link the word I say trauma is like UC Irvine. That's one of the it's the only level 1 trauma center here in Orange County. So that was one of my old hospitals. Another one's a level 2. There's only 2 of those. One is the Orange County Global. Used to be West Med Santa Ana. If you don't have insurance, guys, and you come through our trauma program, anyone want to take a guess for every day in our ICU as a trauma patient? It's $25,000. One day. And typically, you're not going to be in the trauma center just one day, right? So if you don't have coverage, if you don't have some means to help compensate for that, that's, remember, number 1 cause of bankruptcy, right? That's healthcare. So, understand your benefits, understand the care model. You don't have a choice, though, when you end up in a trauma center. It's typically the paramedics or somebody's coming, you're in a car accident, or, someone's having a stroke or acute, infarction with their heart. You got to go, right? So, but if you had your plans together, you have decent coverages, you'll have a better chance of not being financially ruined. Let's see. All right, am I pointing this? Okay. The medical providers, I think we went over the different levels of providers. So your quarterback of your team are called PCPs, or primary care physicians, primary care providers. Typically, they will help be your first point of entry. And that they're typically extended, supported by a cast of specialists, dermatology, cardiology, all the other ones. Some of you in the room here are in medicine. I know we have respiratory therapists, we have nurses, we have pharmacy. Laura and I our original jobs were clinical lab medicine people. So there's a whole lot of different careers that make up the healthcare system. And for young people, college age, remember how much money is being spent? It's kind of like there's jobs out there. So consider healthcare. We need new people, young people to come in to take care of us as we get older. And by the way, you don't have to be a biology person only to get into healthcare. From a career advice standpoint, there's IT, information technology, business, marketing. At Kaiser, we had a department of real estate people in there. We had sales people, we had attorneys. So healthcare to work has to have all those different career levels as well. So from a career standpoint, consider healthcare. You don't have to, be afraid of blood and, poo and all that stuff. You don't have to see all those things. Become like a marketer, or get into information technology, or Dennis Lee, or Dennis does finance a little bit in healthcare. So accountants, there's jobs for you there too. So consider that. That's my plug, because as us baby boomers are getting older, we need to make sure there's a generation of healthcare providers coming up. So guys, girls, consider doing that as well, that there are careers in healthcare and there's jobs. And I know us mom and dads like it when we have children that could go into vocations or professions that they can contribute and make a decent living. All right, so the medical insurance terminology. I don't know, I kind of use, we've all taken, well, most of us have taken foreign languages before, right? You step in that class. God, it's hard to understand anything, because that's part why you're there. You're going to learn the foreign language. Well, welcome to healthcare foreign language, because many terms, right, they're foreign to us. You haven't heard of some of these things that they're talking about. So today, I want to go over at least some key terms, and later on, Jason and I will be doing a little panel thing. So if there's any key things that maybe I didn't touch upon, we'll have some time to do a question and answer. So very important, I talked about when you enroll in those benefits, do you know what you're signing up for? One way to understand better is they usually have tables. You can compare the evidence of coverage, what benefits that health plan is willing to pay. Good benefits, like I said, they'll cover the whole continuum of care. Now the differences will be maybe how many days in skilled will they cover? What are the prerequisites to go for certain levels of care? Good plans, I think in Affordable Care Act, they were called essential health benefits. There were 10 essential health benefits that Affordable Care Act, Obamacare, required every insurer to offer just to be called an insurer. Secondly, they could not charge co-payments or deductibles. You got those free. So it made the cost go up a little bit, but overall the strategy was to try to encourage me, to go get our preventative medicine done. Because in the long haul, it's going to save the government, it's going to save the insurer. So essential health benefits were very important. The other change that Obamacare that I thought, again, this is not a political statement, it wasn't perfect, but it helped address things that were problems in the healthcare system. Pre-existing conditions. Before, if you had cancer or you had a heart situation, that new insurer that you want to go to, they evaluate, oh, you had a pre-existing condition, we're either not going to cover it or we're going to jack up your premium. The Affordable Care Act can't do that. They're a pool, you can't hold them away from having a pre-existing condition to be covered. So that way, we now have good access. Another two more points I'm going to get to about Affordable Care Act. It's not totally gone, but it's being affected and dismantled. Is kids, whether you've been in this room, up to age 26. Before, there was no requirements that the insurance plan could drop us parents from including our kids by age 18. Some plans were doing that. The Affordable Care Act made it up to age 26. So when you hit 26, you're no longer covered. But it did now, up to age 26, make it consistent across the board. Then my last key point is, because I've been blessed to work on the payer side, the provider side, and then the administrative side, where it's called the MLR rule. This is for health, it was a law by Affordable Care Act. MLR stands for medical loss ratio. Medical loss ratio is how much is that insurance company spending of your premium to take care of you. So for every dollar of premium that you would pay to my insurance company, the medical loss ratio will divide how much they paid out that year in claims, paying doctors and hospitals, by $1. So bad health plans out there, and there were many before Affordable Care Act, were paying maybe 50 cents on a dollar. So that means they're pocketing 50 cents, and that 50 cents would go to shareholders, big salaries for executives. What Affordable Care Act did is it said MLR, insurance companies, the big insurance companies, you must pay what's called 85% MLR. So 85 cents on every dollar that we pay to premiums must go to take care of patients. So that's a big difference, right? From 50 cents to 85 cents minimum. And again, I worked for Kaiser for 15 years, and their medical loss ratio is 97 cents. They're putting 97 cents back on a dollar. Those are good companies, right? They're investing back in the patients. They're making a margin. When you're making $20 billion, hey, 3% is pretty good. But the whole point is, not 50 cents on the dollar, 97 cents, or a minimum of 85 cents. So we hope those things, we got to make sure that our congressmen, they keep those types of important elements in the coverage. It affects you, it affects your parents, it affects our children, right? So from that part, that's a piece of healthcare where you don't know those things. You can't read that in your policy, but as voters and things, that's where we have to take some stance, because things that do happen in Washington, D.C. will eventually come back and affect us. Back to terminology here. So evidence of coverage and statement of benefits, that's your roadmap of what your insurance covers. So before you even sign, when you're comparing those insurance companies, look at the evidence of coverage, the benefits, and there's even websites that will compare what's covered, what's not covered, so you can make an informed decision. Which one has, I have up there, I think, deductibles and co-pays. Big difference, right? Good insurance plans. In Covered California, I don't know if you're familiar with that, if any of you had to use Covered California, it's another benefit of the Affordable Care Act. They had 3 different levels of health plan offerings. Gold, right? Guess what? That's the best. Silver and bronze. And they all cover the same thing. But you start looking at some of the differences there. The deductibles and co-payments are very different. So in the gold plan, you're going to pay a little bit higher premium or cost, but then your deductibles and co-payments are less. And so just real briefly, what a co-payment is your health plan requires, like my preventative doctor, I may have to pay $10 for every visit to my preventative doctor. For my pharmacy or lab, I got to pay $5. That's called a co-payment. The big one's called a deductible. Deductible is how much do I have to pay in total out of my pocket before my insurance kicks in. So a really good plan has a low deductible. Oh, you spend $500 for then we start covering you. A cheaper plan, you're going to save some money on the short end, but before that benefit kicks in, you got to meet the deductible. That could be $2,500, $5,000. Makes a big difference, right? So you have to factor in those things because you may save on the cheap by paying lower monthly, which in some people, hey, you got to pay your bills. That's all I can afford. Just understand when you do want insurance to start kicking in, you got to pay that deductible off first, right? They even have, there's individual deductibles, but for families, typically they'll combine that. And it won't be like, if it's $2,500 per person and you have 5 in your family, it's not $2,500 times 5. They might have an annual $5,000 to cover all 5 kids. But to understand that will help you make a more informed decision about which health plan may be better for you. Not just the coverage of benefits, but the cost that go along with that as well. Let's see, in versus out of network. Remember I talked about insurance companies will form contracts with hospitals, doctors, and those are called their networks. And when you are going to enroll in a plan, they'll state who is in my network, which hospitals in the community are in my network, which medical groups and doctor practices are in my network. And those great. If you use those networks, you get the full benefits. But if you go out of network, your benefit coverage is less or your out-of-pocket is more. Simple as that. But understanding who your networks are, what your choices, because again, option A, B, or C, they have very different networks. You want to make sure your hospital, where your doctor has privileges, and your preferred physician is in the network of the health plan that you select. Let's see, EMTALA. It's a federal law. It wasn't here, gosh, probably 15, 20 years ago, it wasn't here. EMTALA is Emergency Medical Treatment Act, essentially that says all insurers must cover any emergency visit, right? You can't use the emergency room, though, for a cold or sniffle or something. But in common lay people, if you think something's going wrong, they can't doubt you, right? They still got to pay that claim. But they can also make a case if you're using that as a clinic, the ER as a clinic rather than a true emergency visit. But EMTALA law enables you, important point, to go to any emergency room that you choose to do so. It's not just where the paramedic wants to take you. You could say, for example, if something happened to me or my family, Laura and I would go, we'd either be going to UCI, in this neighborhood, or maybe Hoag, because we know Hoag's very good. And St. Joseph's, they're good hospitals. Frankly, a couple of the hospitals that I was involved with, they'd be way down the tier unless it's a certain specialty. So EMTALA enables you to go to any ER. Very, very important. That's not out of network if you go to one that's not on your list. The other part, most good health plans, when you're traveling anywhere in the country or world and you have an emergency episode, you're covered. And that's something if you plan on traveling, internationally, make sure you understand what your coverage is. But again, most, if not all, good health plans will have some sort of international medical coverage for emergencies, right? You can't go over to Austria and get a tummy tuck or facelift over there. It's not going to be covered. In fact, some of those are considered cosmetic anyways, and you won't even get it covered here. So before you get things done, right, you want to make sure you understand the levels of coverage, how much is going to be out of your pocket, versus if they're not even going to cover it at all. But internationally, you do have typically some form of coverage. And then I know the travel companies, they want to sell you supplemental and everything, because what they may offer for you is going to be things that aren't covered by your insurance, such as transportation back. When I was in Guam, $25,000 to transport someone from Guam to mainland to get care. And that's not a covered benefit. So, just be aware of what is, what isn't. Let's see, HIPAA. That's a rule that came in under George W. Bush that helps make sure your medical information is protected from others to use it for their gain. So privacy and security is protected by HIPAA, and you do have access to your medical records, but the wrong people don't. That's what it's supposed to do. So if you ever need copies, your provider, hospitals or doctors, must give you access to copies of your medical records, right? Because if you want to go see a different doctor, get another opinion, you want to take your primary doctor's information, you're entitled to have that. They're entitled to charge you, I think, 25 cents a page or something, but the whole idea, that information is very valuable for you. So you do have the rights to have access to that. Let's see, the prior authorization. Some health plan insurance, you got to understand, if you don't get prior authorization for something non-emergent, you may be financially liable for some of those costs or a bigger chunk. So you got to go through the provider, make sure you say, do I need to get prior auth? And you get it in writing if they get prior authorization, because we've had friends go through, get something done, and then they get a big fat claim charge from the provider, say, oh, you owe us because the insurer didn't pay us. So if you can show them, hey, you approved it for me, they have to cover it, right? So that's what's prior authorization. informed consent. It's a process that between your doctor doing the work on you, they need to give you a overview of the risks, the rewards, the benefits. That's an informed consent, and that's all documented. All good providers do that. If one that's not giving you a consent, oh, just trust me, let's do this, that's at your own risk. My advice is get an informed consent, make sure you heard everything, ask questions, and then you're willing to sign it. A lot of times you'll get forms stuck in front of you, oh, just sign this. Hey, you sign that, you just signed off that they gave you all the disclaimers, disclosures, and risks. Thanks, Tom. How much time do I have, Tom? About
10 more.
Okay, thank you. Let's see, in advanced directives, we'll talk a little bit more about that. Do not resuscitate DNRs, very, very important, especially if you have parents. Help know what their wishes are in advance. Bill Oy, he's one of our members of the church, attorney, that, that's what Bill does. He helps do estate planning things, and those are very important, and we're going to talk about that as being a key part of your being prepared, having a plan to avoid, that catastrophe. Let's see, okay, home care. As care moves down the continuum, you need to be aware that there are good options for you today, because both technology and there's businesses now that take care of these things. So in the home care arena, that's trying to keep the loved one in their home environment now, rather than going to an institution. Bottom line is you go to hospitals or skilled nursing, there's sick people there, right? So when you go there, there's chances you're going to get what are called hospital-acquired infections. So the more that you can safely do things at home with the support of others, that's going to be to your benefit. Caregivers, they could be, there's a wide range in quality on that. Caregivers, they should be trained, certified, and you can go through agencies, which, certify, bond, and insure all them. But they're expensive. They average 25 to 30 bucks. I think Miles and Leslie, their Tucky is it's very expensive to them when they have to have 24/7 or 7 days a week. And there's other ways to work around that to knock your costs down a bit. You can go direct to caregivers, but there you have a little bit more risk. You better know how to screen them. You better make sure that they have the training needed to take care of your loved one. But caregivers are a very valuable part to help you. Otherwise, you're going to get burned out, too, at some point, or physically get hurt if you don't know how to do certain things. Let's see. For some of you, I mentioned earlier, long-term care insurance, it's kind of expensive, but if you can afford it, it's going to help cover things that your traditional insurances don't cover. And for the veterans in here, or spouses of veterans, the VA system has some amazing programs. You think of government bureaucracy, but I know even in my own case, my dad was a vet, World War II vet. I was able to get her a VA survivor pension to complement her Social Security that helped us pay for caregiver time. If it didn't apply for that, it would have been more of us, Laura and I having to subsidize that. But there are options out there. A new model out there, and I'm converting my mom and dad's home to an RCFE, a residential care facility for elders. So we will have up to six people we're licensed for in our place, that now mom and dad can go to a place that's more like a home. It was my strategy and Laura's strategy to let mom stay home because she didn't want to go anywhere, so I just couldn't get it done quick enough. It took us about a year right now to go through licensing. So the RCFE model is a pretty good alternative. Your mom and dad own their home outright. This is a way to make care affordable. Let them stay home and convert it maybe to an RCFE. And I'm not managing it, Laura's not managing it. We're having some partners manage it, and they actually pay us a lease rent to manage, or to use our place to bring in 5 other people, for them. Let's see. Planning and legal. Again, disclaimer, not an attorney, but I'm engaged enough with the healthcare system that requires certain key things that you got to have done. Living trust. It's a roadmap. You don't have a living trust in place, it helps communicate what your wishes and interests are, but also, and Bill can attest, it's a legal document as well. It's a way to put your assets in that will help. There's tax benefits and other things that helps make sure your estate and your beneficiaries understand what your desires were. So trusts are important. And Jason, he's going to do his part on those as well. In my opinion, as a healthcare guy, though, very, very important are these other components called the DPAs, your durable powers of attorney. There's 2 different categories. One is for business and financial affairs, and the other is going to be for like your health and medical, areas. So very important. If you don't have those, difficult to talk about, but mom, dad's in the room, Make sure you have, a trust and durable powers. Make sure they're current. Things change in your family circumstance. But those are important documents, because you come into one of my hospitals and your loved one's trying to take care of you. If it's not your spouse, I got to say, are you authorized to represent your parent on this one? And if you don't have that, I've got to go to the courts. Now I get a court-assigned person that doesn't know what you want, take care of you. Not a good situation. So please, please, very important, get a trust. It's going to help protect your assets and have your durable powers. And then there's like an advance directive. That's another component that will help communicate what your wishes are. Difficult to talk to mom and dad about death or about inheritances, all those things. But I guarantee you it's much better to have these discussions and have these documents, because if you don't or they're wrong, it's going to be very complicated for your heirs and others that you want to have certain things made available to. Probate taxes, all those. It makes your whatever you want to leave behind even smaller. So I think those are very, very important documents for you to be doing. Tough to talk about, but things like funeral services, right? I know my mom, as an only child, and same with Laura, she's an only, we had very open talks, and our parents made it easy, letting us know what their wishes are. So when it's that time, we already, we know. We're not guessing, oh, am I doing the right thing? Have those discussions, document them as best as you can, so that way, if mom and dad someday they can't think, rationally anymore, they have dementia, now you know what their originally wishes were. So these sorts of discussions and roadmaps, if you will, are going to help you and them make sure their wishes are being honored. All right, and I just want to put a plug in back in for the veterans, program. Amazing. If your parents, mom or dad were in the military, great benefits. And even my mom and dad had a separate funeral plot at a private place, but hey, the VA said, your mom and dad can come to the VA cemetery. And grandma, grandpa at Evergreen up in LA that's now bankrupt. It's sad. The VA, I assure you, their cemeteries will never go bankrupt. Services are free, and you also, 21 gun salute for dad and a flag. So, and Orange County, by the way, guys, is going to have one, hopefully in the next year or two, we'll have a VA cemetery. All right. Okay. So we talked already about the public resources, Medicare, Medi-Cal. There's the Medi-Medis where you can financially qualify, because Medicare is pretty much age-driven, 65 and over. Key window of time, age 64 and a half to 65 and a half. That's your window of time to apply for Medicare, Parts A, Part B, or other parts that you want. If you don't, seniors, if you miss that window of time, every year afterwards or a month, your premiums will go up for Medicare for the rest of your life. The longer you postpone it, Medicare is going to cost you more. So take advantage of that window. When you hit 64 and a half, even though it doesn't kick in until 65, get enrolled in Medicare, all right? And there's people that can help advise and consult, on which parts of Medicare you should get covered. You want Medicare Part D, others. There's reasons to what you can do to evaluate that. Let's see, covered California, we talked about that. That's based on financial need. California, our state, is generous enough, they will help subsidize. If you're below the poverty line or up to, you get subsidy from the state, and prorated if you're above the poverty line. And the Children's Health Insurance Program for families that have financial qualifies, you can get your kids extra benefits through the CHIPS program. As long as our feds, they haven't funded it, it's part of the budget extension right now, up on hold. All right. I know it's not me being at SOS last night being slow, but here we go. All right, closing key takeaways. It's, let's see here. Take care of yourselves. Get your immunizations. Your doctor has treatment plans. Take your statins or blood pressure meds, all those. You get that one body, right? You can't, replace it like a car. So take care of yourself, number one. Let's see, know your health plan benefits coverage before you make decisions each fall, which is going to best meet your needs. Let's see, active discussions between families, so you understand parents' wills. Parents, even with your younger children, explain to these things. Hey, you have coverage. If you don't feel good, let us know. We can go get you taken care of, right? Sometimes these are tough discussions, but they're important discussions to make sure your family all's on the same page about what wishes are and what the programs that are available to you and them are. Let's see. And people like myself or others, even this room, and people that have their practices. I know there's people in the community that will help you with the medical decisions, integrating that with your financial plans. So consider those resources. Sure, talk to friends, but unless they're experts in the area, the accuracy of the information, you want to make sure these life affecting changes or decisions are going to be based upon accurate information, not what we call false news or whatever that is these days. Let me see. And then very lastly, so I talked about paying for insurance, right? Buying insurance. Well, again, we're people of faith. Pastor Fred offers free insurance here. It's called Insurance for Eternity, right? We're believers, right? This is a gift. God's given us a gift. This is all while we're here living on earth, but even more important to all of us is eternity. And the premiums for no pre-existing conditions, no deductibles, that's our eternity life insurance. And Pastor Fred or other believers can help you get your free insurance if you already don't have it. Okay? Thank you very much. And Tom? Yep. Okay.